Hello everyone, welcome back to another episode of the Breast Cancer Physio. I'm your host Jen McKenzie, lymphedema physiotherapist and ESSA accredited exercise physiologist. In this episode we are going to be talking about what position your shoulder has to be in to comfortably get through radiation. This is a topic that can suddenly hit people when they're about to go into radiation if their shoulder positioning or range of motion is compromised. So if you enjoy this content and you would like to see more, then please hit the subscribe button, give this video a big thumbs up and leave a comment in the section below if you have any questions on shoulder positioning for radiation. So the first thing I want to talk about in this video is what position your shoulder actually has to get to comfortably be positioned for radiation, and that is this position. Now, for a lot of people, that may be quite an extreme range of motion. So this is why I wanted to do this topic, because to get your shoulder into this position may be quite difficult for some people. And where it catches people out is if they go straight from surgery onto radiation. So what I mean by that is some people get diagnosed with breast cancer and the first thing they get done is their breast surgery, but then a lot of people have to go into chemotherapy. And chemotherapy can last for 5 months, sometimes a little bit less time, but sometimes a lot more. But what that does is it gives you time to be able to recover your shoulder range of motion after your breast cancer surgery. The other thing that is happening a lot more these days is what we refer to as neoadjuvant chemotherapy, which means that you have your chemotherapy before your surgery. Again, this can pose a problem for those people if they are then also going on to radiation after their surgery. So if you have chemotherapy, surgery, and then radiation, or if you have surgery and then you don't have chemotherapy but go straight onto radiation, this can catch people out as far as being able to comfortably get their shoulder into this position with not much time between surgery and radiation. So the shoulder positioning requires flexion, which is this motion, but it also requires abduction, which is moving out to the side, and it also requires a little bit of external rotation or extension of the shoulder. So there's quite a lot that the shoulder has to be able to do just to get into this position. So to be able to sustain that position with your shoulder for around 15 minutes every day for 5 days a week for up to 5 or 6 weeks as a typical maximum, that can put your shoulder into a difficult position. So it's not just the fact that your shoulder has to be able to do that, it's also the fact that it has to be able to sustain this position and then repeat that sustained positioning for days and weeks. So let's move on to talk about some of the reasons that the shoulder range of motion can be compromised following your breast cancer surgery. So as an example, pain is a common side effect of having any surgery, but particularly when you have breast cancer surgery, meaning a lumpectomy, mastectomy, or even an axillary lymph node clearance or sentinel node biopsy, there's going to be some post-operative pain. And when you're in pain, you usually will naturally restrict your range of movement. If you've had surgery in your armpit or on your chest wall, you're naturally going to reduce your natural range of shoulder movement. So this is where the shoulder can start to be compromised in terms of its range of motion following breast cancer surgery. The other thing that can come off the back of breast cancer surgery then is stiffness. So the more you limit your range of motion in your shoulder, the stiffer your joints are going to get, so the shoulder joint itself, but then also joints like the rib cage, the thoracic spine, which also assists shoulder range of motion. And then coupled with that is going to be muscle tension starting to develop, just because you're not moving as normally as you would. So muscular tension and joint stiffness are the second reason why your shoulder range of motion can be compromised. The third common reason that shoulder range of motion is compromised is cording. So if you haven't heard of cording, I'll pop a link up to some of the videos I've done on cording. Cording is a really common side effect of axillary lymph node dissection or sentinel node biopsy. So it's relatively unique to having had treatment for breast cancer. You don't see it in other walks of life very often, although it does pop up from time to time. So cording is nerve tension from what I can tell clinically, that occurs after axillary lymph node clearance or sentinel node biopsy, and it can influence your shoulder range of motion, particularly in more severe cases of cording. But the good news is cording can be treated, and I suppose to move back to the topic of pain, pain is also something that should be addressed following your breast cancer surgery in the form of pain medication, ice packs, compression, and so on and so forth. That's more of a medical acute topic to be addressed, but I just wanted to throw that into the video so that we're not just talking about the problem, we're also talking about the solution to the problem. So when it comes to pain, we want your medical team to be helping you to reduce your pain, and when it comes to cording, that's definitely a referral onto a physiotherapist or occupational therapist. The fourth most common reason that people's shoulder range of motion is going to be compromised following their breast cancer surgery is protection, or overprotection in some cases. So what I mean by this is that naturally when you've got a tight sore chest wall and you've got wounds healing or stitches trying to make sure they're not being disrupted, then you are going to naturally protect your chest wall, and by protecting your chest wall you're going to limit your shoulder range of motion. So protection's another reason why your shoulder can suddenly become compromised in terms of its range after breast cancer surgery. The fifth most common reason for reduced range of motion in the shoulder following breast cancer surgery is seromas and haematomas. So a seroma is a common side effect of chest wall surgery, and the technical definition of a seroma basically means that you've got a trapped pocket of fluid. Sometimes they occur in the armpit, sometimes in the chest wall. But again, they can cause pain or pressure, and they can also limit your shoulder range of motion. Another side effect of breast cancer surgery can be a haematoma, so essentially bleeding from the operation, which then turns into old blood, bruising, and this can also cause you some pain in the area where the bleeding's occurred. It can also cause a little bit of scar tissue to start building up early on. So this can also restrict your shoulder range of motion because, again, the discomfort from either a seroma or a hematoma can lead you to restrict your shoulder range of motion. There's another reason why some people are going to be compromised with their shoulder range going into radiation, and that's not so much to do with post-surgical reasons, but more so to do with pre-existing shoulder issues. So if you're someone who's had a frozen shoulder that's affected you, rotator cuff problems, bursitis, calcific tendonitis, these pre-existing issues may mean that you already have restricted range of motion in your shoulder before you even go into surgery for breast cancer. I think on this note, if you are a breast surgeon, a breast care nurse, anybody who's screening a patient who's going in for breast cancer surgery and you know that they're going forward onto radiation, it's a good idea pre-surgically to assess their shoulder range of motion to make sure they're not going to be compromised early on after the surgery and therefore have their radiation start delayed. It's a big problem when patients have really restricted range of motion and then they've got to go on to radiation, because if they can't get this arm into this position for radiation, then often the start of radiation can be delayed. So one of the best things that patients can request from their breast surgeon, or one of the best things that a breast surgeon can be doing, is referring their patients onto physiotherapy or occupational therapy from a really early point in their breast cancer journey, because this is going to allow the physiotherapist to assess them for any issues related to their shoulder if they are going on to radiation. So please make sure that if you're a medical professional and you are looking after patients going through breast cancer, that you're just keeping an eye on how the patient's range of motion in their shoulder is faring before surgery ideally, but then immediately following surgery. As I mentioned before, without a referral onto physiotherapy, if you have a patient who has restricted range of motion in their shoulder, it may mean a delayed start to radiation. And this can be frustrating for the patient as well as the medical team, because everybody wants to get the ball rolling, get things done and get it behind them. So shoulder range of motion being restricted can cause a delayed start to radiation. The other problem, though, on the flip side, is that if you have to go into radiation with restricted shoulder range of motion, it could make radiation sessions quite uncomfortable for your shoulder. And the more radiation sessions that you have on a stiff, sore shoulder, typically the worse the shoulder pain and stiffness is going to get, because you've got to repeat that position every day for so many weeks. On that note though, if you do have a stiff, sore shoulder prior to radiation or starting radiation, physiotherapy can generally continue to be performed on a patient prior to any major skin changes occurring. So for a typical breast cancer patient, if they're going on to radiation, they may have around 5 weeks of radiation. That can differ between individuals, of course. Some people are fast-tracked and they might only have 3 weeks, and some people have to have what we call a booster at the end of the 5 weeks and have to go on to a 6th week of radiation. So whatever your situation, if you do have a stiff, sore shoulder and you're trying to get through your radiation sessions as best as possible, generally speaking, we can still perform physiotherapy, meaning massage, soft tissue release, joint mobilization on breast cancer patients up until around week 3, sometimes even into week 4. Because the good news is that a lot of the time the beam of the radiation doesn't actually directly hit the shoulder where we need to target treatment. So we can be performing soft tissue release around the front of the shoulder here and around the back of the shoulder. We do have to be conscious that sometimes if people are having radiation to this region here, which is referred to as your supraclavicular fossa, or you might see it shortened to SCF in some medical abbreviations, there may be an exit burn coming out behind your shoulder at the top of the back here. So we wouldn't want to be going over that area with really firm massage if there's obvious redness coming up on the back of the shoulder here. But the big picture being that to help you get through radiation, physiotherapy can still safely be performed despite ongoing radiation sessions up until the point where the patient is starting to show signs of skin changes, which is also known as burns. So it's basically up until the point that you can tolerate physio that you could continue to have some. If you don't have access to a physiotherapist or an occupational therapist and you're concerned that you're not able to get your shoulder into this position comfortably before radiation starts, you can go and check out some of my other videos. I've done a video on post-surgical exercises that you can start immediately following your breast cancer surgery. There's a number of videos I've done on cording, how to resolve it and how to make it a more aggressive stretch if it's becoming stubborn. I've also done videos, quite a number, on how to improve the mobility around your shoulder, thoracic spine and rib cage, and these are all really important even moving forward for the longevity of your shoulder range of motion beyond radiation. I've also done videos on my top 5 stretches after breast cancer. The main thing to be conscious of with that particular video though is that's more stretching that's designed following, your stitches being either removed or dissolved, wounds completely being healed, and you don't have any ongoing risks of infection, seromas, haematomas. So just keep in mind that that particular video, albeit which has some good stretching in it, is more for the long term rather than the short term. Thank you so much for watching this video, guys. I hope you've gained some really good information on positioning for shoulders for radiation. If you have any questions, then please leave a comment in the section below and I'll get back to you as quickly as I can. Sorry about the background noise. My dog loves to snore and fall asleep beside me when I am filming these videos. I hope you're having a great week wherever you are. I'm Jen McKenzie, the Breast Cancer Physio, and I'll see you next time.